Hi everyone, welcome to another episode of Simply Healed. We have with us tonight again Dr. Jansen Calalan.
Hello Sean, hello everyone, happy to be here again.
This is the third video that we of a series where we talk about immunotherapy. And here we specifically talking about drug-based immunotherapy, not natural immunotherapy. And specifically we talk about ICI, immune checkpoint inhibitors. So for all the patients who are undergoing or considering to undergo the immunotherapy, ICI immunotherapy, these 3 episodes will be very useful for your understanding. So today, Doc, we're gonna go on the basics. We covered a little about this on the first series.
Yes.
So now we're like sort of revisiting it and giving it a bit more depth. I think, Doc, that's an excellent strategy by you because if we hear it again, you're like, oh, I remember this, and now I understand better. So, Doc, without further ado, let's go and jump into our topic. How does immunotherapy work in the first place? So that goes back down to our own immune system. Right?
Yes. So first, for us to be able to understand what immunotherapy is, we have to understand how the immune system fights cancer cells. Okay? So first off, when a cancer cell happens, okay, when there is cancer cell, okay, how does the immune system detect it? So we have something what we call antigen presenting cells, which are also known as dendritic cells.
Oh, so that's what I always talk about. PPARs increases dendritic cell activity. So PPAR activates the pathways that make your immune system detect the cancer cell.
Correct. Okay. So when the dendritic cell detects the cancer cell, so it gets a bit of the cancer cell, okay, a piece of the cancer cell. Then it presents it to the immune system.
Okay.
Specifically the T cells. Now, when the T cells receive this antigen from the dendritic cell, okay, it becomes activated.
Oh, okay.
Okay. Yeah. Now, I am activated. I will become a warrior. I will become a berserker. Then go
on a rampage.
Yeah, go on a rampage. When I'm activated, then of course the blood circulates, right? The lymphatic circulates. Now, when the T cells go to the tumor, okay, now the T cells are able to kill the cancer cells. Okay, so basically this is how the immune system detects and fights off tumor cells. Now, what if the cancer cells evade detection of the immune system?
Then it's as good as your immune system not working.
Yes.
And that is why cancer tumors grow, right? Because tumors shouldn't exist. Your whole immune system is to prevent tumors from existing in your body. So the cancer cells have a sort of like a security pass that allows a gate pass that allows them to travel without restriction.
Yes. There are a number of situations where we might suspect that this is happening. So number one is you have undergone chemotherapy, radiation therapy, you have had surgery, then the cancer recurred. Or you did not respond to the chemotherapy, the radiation therapy. Okay? Those are one of the possibilities. Also, another possibility would be you've had cancer. You just have cancer. Okay? It's because your immune system was not able to kill off the tumor cells.
And why?
And grow. Yeah.
Because your immune system couldn't recognize the cancer cells.
Yeah.
So Doc, basically, if the immune system can recognize the cancer cell, it will kill the cancer cell.
Yes, exactly. So how does cancer cells evade the immune system? Okay, so there are certain cancer cells which express what we call as PDL1. So PDL1 is programmed cell death ligand 1. Okay, so remember, this receptor is expressed by the tumor cells. This is the security pass of the tumor cells.
Oh, that's the security pass.
Security pass. Okay. Right. Now, on the other side, so your immune system, the T cells. Okay, what do they have in order for them to detect? Okay, this one does not have PDL1. I will go and kill. This one that does not have security pass, I will go and kill. Okay, so the T cells have what we call as PD1.
Okay.
The PD1 is their detector.
Okay.
Now, when the T cells and the tumor cells interact.
Yes.
Okay. So when they interact and the tumor cell shows the T cells, this is my security pass. T cells will now
scan it,
can
Verified. Okay.
Okay, you're
You're
one
clear.
of us. You're clear.
Oh wow, that's why your
However,
cancer cell survives in your body.
Yes. So we now have what we call as an immune checkpoint inhibitor.
That's why the word checkpoint.
Yes,
you know,
the word
it's
checkpoint.
like the
Yes.
police checkpoint.
Exactly,
Yes.
exactly.
Okay.
So the immune checkpoint inhibitor, this molecule attaches on the T cell or on the tumor cell to block that interaction.
Oh,
Okay,
so
so-
you either block the scanner so that no matter what it scans is the enemy,
Yes.
or
Or you equip the
okay, I got it. Let me give an analogy. You either put a blindfold on your soldier so that he attacks everything, okay, or you use something to block the security pass of the cancer so
Yes.
that his security is invalid.
is invalidated.
Yeah, he
okay?
gets attacked.
Now
Okay.
he gets attacked. Okay, so this is basically how this specific immunotherapy works.
Yeah, it's so simple to understand now. Wow, it's very interesting. All the different things that we talk about from many episodes for the last 2 years makes a lot of sense when you just explain this part. So now, Doc, you know all the supplements that are on TV that tell us improve your immune system. They could be making your warrior strong, but your immune system is still totally useless.
Yeah.
Because the one thing that you want your immune system to improve doesn't happen with most supplements out there. It doesn't improve the detection.
Yes, exactly. So that's why a lot of natural supplements, although there are evidence that, let's say for example, turmeric, there are a lot of evidence that turmeric works against cancer cells. But how come
You can eat all the turmeric.
You can eat all the turmeric and your
Nothing.
cancer doesn't, nothing happens, still nothing happens because of this mechanism. And there are patients actually where you give them turmeric and cancer disappears. So, I mean, how do you reconcile that?
Yes.
It's because of this.
And here's the good news, okay? I'm the PPAR expert here. So, PPARs is able to increase the dendritic cell activity, which allows the detection of the cancer. So, if you've been eating turmeric and nothing's been happening, take PPARs and then you'll see the turmeric start to work because it's the mechanism that we're talking about. Wow, Doc. Thank you
Okay.
so much.
So next, let's move on to what are the medications. No?
Yeah, what are some of the drugs you will be taking
Yeah.
if you are going to
So
go?
there are
I
a lot of different drugs which are immune checkpoint inhibitors, no? But these are the most common ones. So number one will be pembrolizumab or your Keytruda, nivolumab or Opdivo, and atezolizumab. So pembrolizumab is mainly used for triple negative breast cancer cells. Triple negative breast cancer
Okay.
and hepatocellular carcinoma, but it's most studied in melanoma.
Okay.
Atezolizumab is for liver cancer.
Oh, that's important.
Yes. For atezolizumab, it's usually given in combination with another molecule. Okay, but we won't go into that already. Now, next one is nivolumab. Nivolumab is used for non-small cell lung cancer, head and neck cancers, and renal cell carcinoma. Okay.
Doc, we talked about how immunotherapy is the next wave of cancer treatment. In many ways, less harmful than chemotherapy. But there are still side effects
Yes,
for
that's true. That's true.
immunotherapy.
Yes.
What are some of these important side
Okay.
effects?
Now, before we go into some of the side effects, no, let's compare this to chemotherapy.
Okay, that's great.
Okay, so for chemotherapy, we all know how bad it can get because your immune system goes down, your blood cells goes down, you know, everything goes down, even your hair goes down. Okay, so for immunotherapy, the side effects are much milder,
Okay, that's
but
good.
they are still there. Okay, the difference is the more common side effects for chemotherapy is hematologic or blood side effects.
All right.
Okay, immune system, white blood cell goes down, you become anemic, you have you can have bleeding side effects, you can have gastrointestinal side effects, no? For immunotherapy, the blood side effects is actually rarer.
Oh,
It's
that's
much rare.
all right.
So in immunotherapy, it's very important that your immune system does not go down or it does not become suppressed.
Yes, which is why it's important to notice that if you're going for immunotherapy, very oftentimes you're first prescribed chemotherapy. So it's so important that you protect yourself during the chemotherapy process, so that when you move to your next phase of immunotherapy, your immunotherapy will work. This is where I would really encourage you right, to go for a consult with Dr. Jansen, where he has protocols that will help you protect your system while it's undergoing its chemotherapy. Because the immunotherapy is actually much more expensive than the chemotherapy. So it's like really sayang or a waste of your resources if your chemotherapy hampers or diminishes the more expensive immunotherapy that comes after it. So what you can do is you gotta have an appointment with Dr. Jansen. Go and have an appointment with Dr. Jansen so that he can protect your immune system from the damages of chemotherapy, so that when you start using your more expensive immunotherapy, you have the maximum impact. Now, as to why you have to go for chemotherapy, even though it might compromise your immunotherapy, that's for another video, because that's another long discussion. But of course, your uncles have very good reason why you go for chemo first, then immunotherapy, even though you do compromise your immunotherapy with the chemotherapy.
Okay. So, in order for us to understand the side effects of immunotherapy, we have to understand first on how it works in the first place. So, let's review. How does immune checkpoint inhibitor work?
Security pass.
Security pass. Now, it's not just the tumor cells that shows the security pass or the PD-L1 receptor. There are also host organ systems that express this security pass, so that your immune system does not attack your own organ or attack
that is
attack
true.
your own body.
Because the T cells, the warrior cells, the moment they get activated, they run all over your body. They don't they circulate in your bloodstream.
They circulate.
So they could end up attacking everything. So that means then your body must issue security pass to all the other organs.
The healthy organs, the normal organs.
So so that your gangster, enraged berserker immune systems don't attack them.
Yes.
So if you disable the security pass, you end up
attacking your own.
So an immunotherapy side effect, very different from chemotherapy. Chemotherapy, because it bombards the system and it damages the blood cells. This one, you have a chance that your own immune system attacks
your own body.
So the side effect, the possible side effects of immunotherapy is autoimmune disease.
Correct.
Which is like lupus. Lupus is when your own immune system attacks your healthy cells, right? That's what lupus is. So since you disable the security pass, there's a chance your own immune system starts attacking your healthy cells.
Exactly, correct. So the main side effect of immunotherapy is autoimmune diseases. Now, we have a number of ways on how we can manage autoimmune diseases, but we're going into that later. First, let's describe first what are the different side effects specific to different organ systems. So this image shows you the different organ systems and the different diseases associated with immune checkpoint inhibitor therapy. Then there are more common side effects and the rarer side effects, as shown here in this table. So the more common side effects in immune checkpoint inhibitor would be gastrointestinal, endocrine, and dermatologic. So there are a lot, but I won't discuss them all. So we focus on the more common ones. So gastrointestinal, like your nausea, vomiting, diarrhea, you can still experience those together with with chemotherapy. So they are similar in that aspect. However, chemotherapy does not have endocrine side effects. Immune checkpoint inhibitor therapy has endocrine side effects, specifically hormonal imbalances, hypophysitis, so that's suppressing the function of your pituitary gland, thyroid dysfunction. So with this respect, you can actually experience symptoms of hyperthyroidism and symptoms of hypothyroidism. Okay, so it's very important for your doctor. If you experience these symptoms, it's very important to follow up with your doctor. Also, dermatologic side effects like rash, itching, vitiligo,
I think that's
white spots.
A simple reaction of your immune system attacking your skin, right?
It's like allergic reactions.
Yes, like eczema, psoriasis.
It's very similar.
It's autoimmune response.
And dermatologic side effects are the most common ones. So if you are someone who's receiving immune checkpoint inhibitor therapy and you experience these side effects, especially you have rashes, please go and follow up with your doctor. So because you might be experiencing an allergic possible allergic reaction. Okay? And the rarer ones, so like your neurologic, cardiac, pulmonary, hematologic. So here, hematologic is rare in immune checkpoint inhibitor therapy, although it can still happen. Nephrologic, like your kidney, your immune system attacking the kidney, musculoskeletal, and ophthalmic, your eyes. Now, there are actually a lot of things that can make the toxicity more enhanced or more pronounced. So, what are these? For gastrointestinal toxicity, okay, please avoid taking antibiotics at least 2 months prior to the start of your immune checkpoint inhibitor therapy, because this can affect progression-free survival and overall survival. So it has been shown that if you take antibiotics within 2 months of starting immune checkpoint inhibitor therapy, then the period of time wherein you are in remission shortens.
Wow.
And your lifespan decreases.
Wow.
Overall survival.
Wow.
Okay? So, please take note of that. For kidney toxicity, please avoid taking NSAIDs. So, NSAIDs would be like your ibuprofen, mefenamic acid, diclofenac, dextroprofen. Okay, so these NSAIDs. Okay, so avoid taking those. Avoid taking antacids as well, like your omeprazole, pantoprazole, esomeprazole.
Wow.
Okay, because these can heighten or make the immune checkpoint inhibitor therapy more toxic to your kidneys. For pulmonary toxicity, asthma, COPD, and previous history of receiving radiation to the chest or to the chest area, no? These things can make the side effect of immune checkpoint inhibitor therapy to the lungs more pronounced.
Doc, when you share all this, I hope for our audience and for myself, I'm so impacted in the sense that we always we downplay how much your general health affects your cancer treatment. Because Doc, you talk about taking antibiotics. If you take antibiotics before going for your ICI treatment, your remission, basically your lifespan actually drops. But why would you need to take antibiotics in the first place?
Yes.
Right? Because you have other comorbidities, because you have your own immune system is weak and you got another infection, not cancer.
Exactly.
Right? So it really highlights that all these factors that will create side effects in your treatment comes from general health. Right? So it's so important that cancer patients also know how to prepare themselves before you start your treatments, that you don't ignore the other general health issues in your body. They compound or basically they make it even more complex to treat your cancer, and some of them have a direct negative impact on your cancer treatment. So again, I want to encourage you, engage Dr. Jansen to support you through your oncological protocols. Go for a consult with him. He's worked with so many patients and they're doing so well now with their chemotherapy, immunotherapy. And it's really wonderful. If you work with a nutritionist won't be able to explain how ICI works. That's why you want to make sure your doctor that's supporting you through all these protocols understand these protocols, which is why I like it. I love working with Dr. Jansen, because even though he does the lifestyle medicine support, he knows so much and is literally so well versed in the actual protocols oncologists go through. So I will encourage everyone. You can come to our AMA, ask me anything, which is coming up soon. But really, go for a one-on-one so that you can get real support through your entire treatment process. All right. So Doc, since we're talking about how to manage adverse effects of ICI, how do we manage the adverse side effects of ICI?
Okay, so management of the side effects of immunotherapy would be very similar to how we manage autoimmune diseases.
Makes sense.
So number one, of course, is supportive treatment. Okay, so whatever the patient experiences, whatever symptom the patient experiences, we prescribe medications, we prescribe lifestyle prescription to address that specific symptom. Also, steroid therapy is a mainstay. So why is it steroid therapy? Because it's steroid therapy.
Antihistamine,
immunosuppressant, and antihistamine.
I hope everything is clicking in your mind now, right? Autoimmune disease, steroids used to suppress, is antihistamine.
Anti-inflammatory medication. So these things. So aside from steroid therapy, we also have immunomodulatory therapy drugs like your DMARDs drugs, your PPAR therapy, and other procedures that manages the immune system. Okay.
So, Doc, for you, you're actually using natural PPAR therapy.
Yes.
Your
yes,
PPAR
yes.
therapy is based on, as much as possible, instead of drugs, is
Natural.
the foods that you
the
eat.
food that you eat. Okay. Now, there are groups of people where we cannot give immunotherapy. Okay.
That's important to know. And give the audience just one guess. I'm sure you can guess because you understand now, right? The groups of people that cannot use ICI therapy are patients who have autoimmune diseases.
Correct.
Because the side effect of ICI is autoimmune diseases. And of course, based on that, there's another group of people, Doc.
Yeah. Those who have received organ transplant.
Because your organ transplant is considered to be a foreign
Foreign
body,
body, so
and if your immune
yes.
system doesn't recognize any of the security pass, it's gonna attack it, and that makes it worse.
Okay. So now we answered the question that we've asked in the previous episode. Why is it that a plant-based diet is so good for immunotherapy?
Yep.
Yeah, it's because a plant-based diet can really make your immunity more hostile to cancer cells, to bacteria, to viruses. It makes it work properly. It makes it work effectively. Okay.
It basically makes your fighting soldiers in your immune system stronger,
Yes.
fiercer. And
Yes.
now that the key way the ICI works is to remove the security pass, you just want these fierce fighters.
To just kill off the cancer. Okay? This is especially useful for more advanced cancers. Okay? Like stage 4 cancers, cancer recurrences, immune checkpoint inhibitor would be more effective in these groups of people. I'll give you an example. Dostarlimab. Dostarlimab is a very recently tested ICI therapy against colorectal cancer. So the patients, colorectal cancer patients, stage 4, nothing can be done anymore. They received Dostarlimab. All of them went into remission.
Wow.
100%.
100% cure rate.
So it's really wonderful on how these drugs can really work in amazing ways.
But Doc, it really also amazes me that all these drugs did was just to expose the cancer.
Yes,
Which
expose the
means
cancer.
the
Yeah.
thing that kills the cancer
Your body.
is
It's
more
your body.
effective than chemotherapy,
Yes.
more effective than anything. It's already in your body.
It's already in you.
It's
okay.
already in you.
Now, with the side effects of immune checkpoint inhibitors, right? So we have autoimmune diseases. It's the same. A plant-based diet is so good, no? It's so high in antioxidants, so high in anti-inflammatory nutrients that it can nullify the side effects of immune checkpoint inhibitors. Why? Autoimmune diseases. Those patients who have autoimmune diseases.
Yeah.
The dietary pattern that they undergo where we see the most remissions is a plant-based diet.
So
Okay? So the plant-based diet is the answer to the side effects of immune checkpoint inhibitor as well. Okay?
So not only does it boost the effect of the immunotherapy, it manages the side effects of the immunotherapy.
Yes.
So there you go. I see many questions are coming up, Doc. I just want to wrap up before we go into our AMA, which is that immunotherapy works by mainly disabling the security pass that allows the cancer to go undetected. And the case that Dr. Jansen just brought up, the 100% effectiveness on even late-stage colorectal cancer, the killing power is actually in your own immune system. All the immunotherapy did was to disable the security pass. So that goes to show all of us that there are many things that we can do to increase the killing power of our immune system, from antioxidants to so many lowering inflammation and all of that, right? Doc, thank you for that wonderful explanation. Now we understand how ICI therapy works, and we know that we can do so much to make it work even better and what to avoid. Yeah, I see the questions are coming in, so without further ado, let's proceed to our Ask Me Anything segment.